Friends, today, after a successful liver transplant and a complete recovery in the ICU and ward, you are all set for a discharge. And I would like to explain you some of the discharge instructions which are very important for a long-term healthy life after liver transplant. Let's divide this session into 4 parts, which is medications, labs or blood test, measures for control of infection or prevention of infection, and regular follow-up. So let's start with medication. By now, you have spent a day in the ward taking care of your own medicines, and you have already had a session of medication teaching with our staff. I would like to reiterate few facts about the medicine. The most important medicines that you are on includes the immunosuppression medicines, which includes tacrolimus, MMF and steroids. Now tacrolimus, what is called as a calcineurin inhibitor, is a very important medicine. It is to be taken empty stomach. So usually what I advise to all my patients is that set a time at morning and evening, say 7 o'clock in the morning and 7 o'clock in the evening. Avoid eating anything for half an hour before and after this medicine. Whenever the medicine drug level is to be done, that is called as tacrolimus level. Please take this medicine only after the blood sample is collected on that day in the morning. The reason being, we want to monitor the lowest level in your blood, and that would be before you take the next dose of medicine. The second medicine is MMF. This is again a medicine to prevent rejection. This is to be taken after food. The third medicine is steroids in the form of Visolone or Omnacotil, and this is also to be taken after food. After few weeks, so usually after 4 to 6 weeks of the transplant, the steroids are gradually tapered off. On your discharge instructions and during your follow-up, you would receive the schedule for taper for steroids. So blood tests or labs. For monitoring your graft function or for surveillance of graft function, to measure the health status including kidney function, electrolytes, blood counts, regular follow-up with blood test is extremely important after liver transplant. In the first 4 weeks, there may be blood test twice a week or once a week, and that gradually becomes once a week for the next 2 months, and then once in 15 days. After 3 to 6 months of your transplant, these labs becomes once a month. Whenever the blood sample is to be collected for tacrolimus level, as I described in the medication section, please do not take the medicine till the blood sample has been collected. Even if there is a delay of 1 to 2 hours, it is not a problem. Wait for that duration, and after the blood tests are collected, then only take your tacrolimus. Please ensure that these reports are filled up in your follow-up discharge sheet regularly by you, and that is to ensure the compliance of a patient. As well as these labs are communicated to our team at right time. Coming to the next part, which is prevention of infection. Now for a layman, I can explain that the major sources for infection could be air, water, food or contact or touch. And if we take good precautions in all these areas, it is very simple to prevent infection. Okay. Now starting with air. So one, I suggest to use a mask, a triple layered mask. It could be a cotton cloth, homemade mask, or a triple layered mask, a surgical mask which is freely available across the various medical shops. What is important before you go home is that the AC vents should be cleaned by the professionals before you go home. What I recommend you is that any form of construction activity needs to be avoided by you. So if there is a construction activity going around your house, make sure that the windows on that side are completely shut. For the mosquitoes, I suggest that use full sleeves clothes, full pants and socks to reduce the chances of getting a mosquito bite or a small injury. Coming to the next part, which is water. For the next 3 to 4 months, I recommend use boiled water. So let the water boil for around 20 minutes. Even the container, the water bottles or the glass bottles, they can be boiled and cooled, and the water can be stored for use for you. It is the boiling that is important, not the temperature. So what I mean is that if you want cold water, please go ahead. You can even make ice from this boiled water. But please make sure that the water is boiled for 20 minutes before you use it. Okay. Food hygiene. So the first important thing is handling of the food. So whoever is handling the food, which is cooking, getting food for you, please make sure that they wash their hands regularly before handling the food with soap and water. Certain precautions in the food is fresh, which is home cooked, and cooked food. Okay, the food should be cooked at home. Please avoid outside food. Please ensure that you have only cooked food and not raw food. And please ensure that the food is cooked fresh. So morning breakfast is cooked and you finish it. Lunch cooked again and dinner cooked again for you. And you consume the food in the next 3 to 4 hours and not store it in fridge and then have it the next day. When it comes to raw vegetables or foods or fruits, avoid salads which are difficult to clean. Avoid green leafy vegetables for now without being cooked. Okay. Certain things for salad, the things which could be peeled can be used. So simple things, say kakdi, you can always peel it and it can be used by you in salad. Fruit. So I recommend that do not have more than 1 to 2 fruits a day. One is ideal. Fruits which can be peeled are best suited for you. So simple things like orange or santara, mosambi, fruits like watermelon, kalingar or papaya or muskmelon which could be peeled. Again, a bowl of them in a day is good enough for you. Apple, it can be steamed and you can have it. Certain fruits like grapes, strawberries, blueberries, which we cannot peel, I suggest to avoid them for the next 3 to 6 months. Sometimes your potassium may go high, and in that case we suggest you to boil the vegetables and remove the water and then use those vegetables for cooking. Coming to the next part of the discharge instructions is regular follow-up and regular medicines. Please ensure that you do not miss your medicines every single day, morning and evening. Compliance for medicines is extremely important for your short-term and long-term outcome of the liver transplant. Regular follow-up, weekly follow-up in the first month, once in 2 week follow-up in the next second and third month, and then once a month follow-up for the entire year is very important to monitor your graft function and ensure that you have a healthy, successful life after a liver transplant. Thank you.